Hello, everybody. I'm Christian Coachman, and we are back with Coffee Break with Coachman. Today, a special guest from Germany, an expert on digital dentistry. I believe you will all have fun with interesting information that we're going to share here, basically about the digital workflow and more specifically about intraoral scanning. So just give us a couple of seconds, watch the Coffee Break with Coachman intro, and we will be back in a few seconds. So I want everybody to give a warm welcome to my guest today, Dr. Ingo Baresel from Germany, my colleague and another great expert on digital dentistry. And a few weeks back, I did a post on Instagram specifically about iTero in the restorative environment and how some people still believe that iTero is a orthodontic scanner only, and how we've been using iTero for the restorative workflow. And the people that I know, experts on digital workflows, using iTero as well for restorative. So I invited one of these experts, Dr. Ingo, since he's a iTero user, an expert in the restorative workflow with iTero, to discuss a little bit more about this post and the discussions that came after this post. So Ingo, first of all, thank you so much for opening time on your schedule, your precious time to be with us online in this podcast. And I want you, before anything, to give us a little introduction. Who are you? What is your background? A little bit about your office and your work, please.
So, thank you, Christian, for the invitation, because it's really something what is important to me to speak about intraoral scanning, because I'm a user of intraoral scanners since years, and I'm really a fan of it. So my name is Ingo Baresel. We have an office together with my brother and my father here in a little town near Nuremberg called Karlsburg. We use an intraoral scanner.
And where this meeting will happen?
This will happen in Düsseldorf. So I'm really excited.
A meeting only about intraoral scanners, and you will have people talking about all different systems, comparisons, research.
Exactly. This is always, these are always the topics. So this year, on the first day, we made something like a competition between scanners. So we have nearly every intraoral scanner on the market in workshops. So you can go at 1 o'clock to iTero, at 2 o'clock to 3Shape, at 3 o'clock, and so on. So you can have every scanner tested and ask them, why should I buy your scanner?
That's amazing. And
yeah, and on the second day we have lectures really with specific topics, just about implant workflows, just about using scanners with children in a chairside workflow, all the things like this. So how can I use a scanner, not just for impressions, because now we have scanners which are not just able to do impressions, and we can use them for all the other things now too.
Became a complete imaging system now.
Exactly.
When exactly this meeting is happening?
This will happen on the 4th and 5th of October.
Wow, this is amazing. It makes me feel like going. I love the idea. Congratulations for this initiative.
Thank you.
We need, we all know that scanners are the gateway to the future of dentistry, is the entrance, is the first step, Everything else about digital dentistry could not happen if we don't start with the scanning. So such an important topic, and I really would love to know more about this association and start participating on your events. So that's very, very cool. You mentioned that you started scanning 8 years ago, right?
That's right.
And very interesting as well. After you started, we all know there's a learning curve. We all know that 8 years ago, scanners were not at the quality they are right now. So the pioneers at that time, like you, kind of struggled through the process of helping companies to overcome the issues and develop the solutions to transform the scanner, like today, in a tool that absolutely every dentist should have and should use. My question is, from when you started, how many years it took for you to eliminate completely impressions, regular impressions?
So it's a little bit difficult to answer this question, because we stopped eliminating completely, I think, 3 or 4 years later, because the problem still was scanning implants.
Yep.
It was, in the beginning, quite easy to learn to scan teeth. This was not the problem, and we tried every week. We tried more. Just one tooth, just one crown, and then we extended it to 5, 6, 7, whatever was possible. Just after IDS in 2015 and 2015, we got the first scan bodies for Astra implants, which we used. And there we started the workflows even for implants. So perhaps a few months later, we really did nearly everything digital. What we're still not doing completely digital is total prosthesis.
Over implants?
Yeah. No, over implants we do it. But just when you have no tooth anymore. So if you have things like...
Yeah. Fantastic. So can you see if you agree with me, if we could divide intraoral scanning in 5 levels, something that just came to my mind. I believe that the first level of substitution is using scanners on first appointments as diagnostic impressions, right?
Yeah.
Let's substituting the alginate of initial impression to generate a diagnostic model. That's the first level. Then we can think about a second level of scanning for restorative over teeth. So prepping and scanning the preps and doing restorative workflow. Then I would also add to level 1, maybe orthodontic scanning. So diagnostic models and orthodontic scanning. Level 1, the easiest one to substitute. Level 2, restorative over teeth. Level 3, over implants, small bridges, single unit, small bridges. Level 4, big implant rehabilitations. And level 5, full dentures, edentulous patients. Do you agree with this path of difficulties and implementation when using scanners?
I totally agree. Because still, when we have huge implant works, this is really still difficult. But this is not mainly a problem of the scanners. It's mainly a problem of the printed models. Because when we have to work with printed models, and mostly we have to, this is always the biggest problem because they're not that accurate as they could be. But we're now doing some tests, perhaps to solve that problem too in the future.
So you agree that level 1, 2, and 3, meaning diagnostic models, orthodontics, restorative over teeth, and small implant bridges are completely under control when it comes to intraoral scanning.
Absolutely. Absolutely.
And we still have some challenges, but we see many people already working hard to overcome that on full implant, big implant prosthesis. And I totally agree with you. Something that maybe will never be able to be completely substituted by scanners is the fully edentulous patient, basically because the fully edentulous impression is not only an impression, but is also a soft tissue conditioning device, right?
We need the function. We need the function. And I don't see how in the future we should add that. For sure, you can do something like an impression and scan, and functional impression and scan it with a scanner. But this is not really fully digital. This is still an analog step. So when you want to do it completely digital, I don't see how that could work. Perhaps we can do it in the future, but I think that's really, really difficult.
Because what is the problem on dentures? Even though dentures are kind of reducing when people are wanting to do fixed full arches over implants, but still it's a solution for many patients to have a removable full denture. That means that we are not only impressing, not only capturing the part of the ridge that doesn't move, but we are the edges with the tissues and the things that are moving. You actually need an impression material to function the patient, and that movement to mold the edges of the impression. So doing that with a tray in the mouth is still mandatory, and then you can scan that tray, right, and work into the digital world, right?
Exactly.
Fantastic. Now, I mentioned about my post on social media, on Instagram, that I did a few weeks ago, where I was explaining that here in our office, since we got the iTero, we've been using iTero not only for Invisalign, and digital orthodontics is the obvious move. Of course, the workflow between iTero and Invisalign, it's probably unbeatable so far. And we've been working, of course, also with the DSD workflow integrating with Invisalign. So I believe it is a golden standard in terms of facially driven digital orthodontic workflow, iTero, Invisalign, and now with the DSD principles in it. Now, people ask me all the time, Christian, I need to buy a scanner. I understand I need a scanner. Which scanner should I buy? The magic question, right? And we know it's not an easy answer because we have several great scanners available, and there's always details, pros and cons here and there. And my post at that time was not to say that iTero was the best, but just to say that iTero can also be a good restorative scanner. And as you know, people get very nervous online, and the discussions heating up. And was very interesting. One of your comments, I want to repeat to everybody here your comment on that post, and then give you the word to explain with more time your experience. You said, you all have to accept that there are many intraoral scanners on the market, which are all accurate and can be used for restorative work. I have different scanners in my office, including an iTero Element 2, 5D, 3Os 3, and Virtual Vivo, and worked with nearly any scanner on the market, including Restream, Medit, Dental Wings, Sirona. We did about 3,000 cases with iTero. That's really an impressive number. I really want to pick your brain with that experience. And it works perfect and easy. That doesn't mean that others are bad. You have different scanning strategies, settings, options, software features, and I could explain now for 2 hours the advantages and disadvantages of every single scan. It's the same thing with buying a car. I love the comparison and the analogy. Different companies are on the market. and we can discuss if Audi, Mercedes, or BMW, for some reason, all Germans you mentioned, definitely the best cars around, is better. But honestly, all are great cars. Finally, you have to try which fits best to you, but stop blaming the others. I love the way you finished the sentence. So tell me how you came to these conclusions and opinions in terms of ability to get in depth in all of them, you know, to get in depth with all of it. Usually all the opinion leaders, they're very good at one scanner. And when they go on stage, they're trying to convince everybody, my scanner is the best. And I really love to talk to people that are privileged enough for some reason to have all the scanners and try all of them. We have this option here in the office because of the courses. We use 3-4 different brands, so we can really make this healthy competition between them. So I want to hear from you. What did you learn throughout these years comparing all the systems?
So first of all, if I choose a scanner, the main reason why I choose a scanner is accuracy. So this is still the most important thing in dentistry. We have to have an accurate scanner. But when you look now at all the research which is done, especially in the last months and the last year, and you compare all those scanners, most of them are accurate enough to make a full arch scan. We talk about 5 microns better and 10 microns worse, but to be honest, in our daily business, 5 microns are not really important. So we have to accept, and everybody who is talking about intraoral scanning have now to accept that intraoral scanning is accurate, not just on single teeth. We are accurate in full arch scans. So this is the main reason to choose a scanner. When I have a scanner which has no research about it, I would not choose it. Mm-hmm. Because sometimes, as we all know, the companies tell us everything to buy something. So I want to have accuracy and research. This is the most important thing. But then, when we accept that most of them are accurate, I have to look at the features. What do I need? I have to look at the price. What can I afford? What do I want to do with the scanner? And there are so many differences between all those scanners where you have to think about which is the right one for me. So my personal opinion is I'm looking at the scanning strategy and I'm looking at the scanning position. This is the most important thing for me. That means not the way I scan a patient, it's the strategy behind it. How do I scan a patient with many preparations in an accurate way? And there are big differences between all those scanners. And there are several other features like caries detection, time-lapse functions, recording the bite movement already, HD photos, whatever. There are so many options now what we can choose. And I have to choose which fits best to me. So it doesn't make sense to blame any other scanner because they're accurate. And you have to have experience with the scanner. If you are used to the scanner from company A and you grab the scanner from company B, it's a quite different way of scanning. So you cannot say, I can do it with A and I cannot do it with B, and this is bad.
So one question, as I'm learning from you, and I agree with that, you're saying that accuracy, when we talk about the top scanners, accuracy is not a differentiation anymore because they are all there. So we don't need to make a choice regarding that. That was a case in maybe 3-5 years ago when the differences were still big. Nowadays, this is not anymore the main reason why you choose one instead of the other. Now, another thing that used to be a great topic, and I remember the last IDSs, all the scanner companies were usually talking about precision and speed, precision and speed. Oh, buy my scanner because it's more precise. Buy my scanner because you can make an impression faster. And I believe that the speed is also not a differentiation anymore because they're all more or less the same. Do you agree with that?
I agree totally, and I don't like those people which are walking around on IDS and making some comparison and are not used and familiar with the scanning strategies and how to grab the scanner and whatever. And then they say, oh, the one is much slower and the other one is much faster. That's not true. With nearly all those scanners, I'm able to do a full art scan in between 3 to 4 minutes. So, and if you're not cannot do this, you have to train.
Exactly.
This is not a problem with the scanners.
Each scanner has a slightly different scanning strategy, and you need to
That's
have
it.
a curve with each one. So if you're used to scan with one and you go to a congress and you're trying another one, you cannot compare the speed because, oh, I'm not going to buy this one because I'm much faster with that. Of course, you've been using that for 1 year and now you're trying a different one. So the conclusion here is don't choose a scanner because they are saying it's more precise, and don't choose a scanner because you feel you're faster with this or with that, because it's all about training and you can be fast with all of them. Another topic that used to be a big thing that I also believe is not a main topic anymore is the size of the wand, the size of the tip, right? People were probably, oh, my scanner is smaller, my scanner is smaller. First, and I want to hear if you agree with me. First, smaller is not an advantage because actually if you're bigger, you can have a bigger area that you're scanning. And second, because the tip of all of them, some smaller, some bigger, but when you have a tip in a certain size, it can actually help you protect the area from the tissues to scan. So the sizes of all the scanners nowadays, they're pretty reasonable, and the difference on size is not anymore an advantage. Do you agree with that?
I agree totally, because just look at the new Prime Scan and then compare the Prime Scan wand with the wand of the Omnicam. It's much bigger, but it's now able to scan much faster because it has a much more bigger angle to scan now. So it captures more of the tooth than it did before.
Areas, so less stitching.
Exactly, and the more stitching you need, the more inaccurate the scan will be. So, if you compare to the iTero, to the Trios, now the Prime Scan, every scanner who uses a confocal microscopy has always a little bit of a bigger wand because the technique has to be put to the handpiece. We cannot put it into the computer. We have to put it into the handpiece. And this is the reason. Look at the step from iTero to now to 5D. Size has not changed. Look at Trios 3 to Trios 4. Size has not changed because it's not possible technically, but it's extremely easy to scan, and you don't put the whole handpiece into the mouth of the patient. You just put the tip into the mouth. So
it's like the iPhones. At one point in time, instead of getting smaller and smaller, they started to get bigger again.
Yeah.
So it's kind of like the bigger brings other advantages that we talked, less stitching, a bigger area, and more support to protect the area that you're scanning. So the conclusion here that is very interesting for everybody to understand that precision, speed, and size, that for many years were the three biggest marketing tools of all the scanner companies, are not anymore an issue and shouldn't be the reason for buying one instead of the other. So if precision, size, and speed are under control and they all got pretty much at the same level, we are down to price, workflow, special features, and support. Do you agree?
Exactly. These are the topics between you have to decide which scanner you buy.
So price, of course, it doesn't make sense for us to discuss because everybody can go online, see the prices, and compare the prices. You need to, on one side is definitely the price, but in the other side, to balance the price is the workflows that you can do, the features, the extra features that the scanner is bringing to the table. And of course, customer support is probably one of the most important, and that is understanding customer support in your region, because companies, they are better on one city, better on one country than on others. So this is another topic that it doesn't make sense for us to discuss, because you need to research on your area. So I want to focus on workflows and special features, because I believe that is something that is the number one reason to make somebody understand which one should I buy. So why do you believe, how the iTero changed the way you do dentistry? What are the positive things about iTero in terms of the workflows and the special features of iTero that you think make this scanner a special scanner?
With iTero, the main reason for me to use iTero is the workflow, is the scanning strategy. I always say we have two things. We have a scanning path and we have a scanning strategy. The scanning path is something every company tells us to scan the patient, usually from the occlusal, the lingual, and the buccal side. This is nearly with all scanners the same. So the big advantage of iTero is that you can scan one tooth after the other, one preparation after the other. So this morning, I did a patient with 14 teeth in a row. We made really a huge case. And I scanned the first one, put out the retraction aids, scanned the first one, took my time, scanned the second one, took out the retraction aids, scanned the third one, and so on. So I can just care about one. This is how iTero thinks. Compared to most of the other scanners, you have to scan everything in one scan. So you have to take out 14 retraction aids and scan them occlusal side, lingual side, buccal side. And it was the lower, which I did today. So what will happen? First of all, I cannot control 14 teeth, just collapsing gingiva, blood, saliva, whatever. I cannot do this. Perhaps I'm not a good dentist, but I cannot do this. So this is analog dentistry. This is how we did it before.
Yes.
And what I'm doing when I'm scanning with another scanner, I have to scan it in the scanning path, occlusal, lingual, buccal. What will happen to the tongue? The tongue will overlap on one side every time. So afterwards, I go back to the scan and I have to correct it in every single area. And I have to cut it out, rescan it, cut it out, rescan it. And then we have the same problem. We have stitching. We have, again, matching situations. And we want to have as less of them as possible. But this is really hard work. And with iTero, you scan just one after the other, then again on the whole area, and you have time to care about one after the other. And this is, for me, the main reason what makes it so simple to scan a patient, even with many restorations. And this is why I always say in every one of my lectures, I'm a better dentist since I do intraoral scans, because I see things that big, and afterwards I can correct if I did something wrong.
You nailed it. You really nailed it. And now I'm speaking as a technician, as I was a technician for years. And I can tell you that one of the biggest nightmares, the two biggest nightmares of every technician, tooth preparation and impression. Tooth preparation and impression. Even when you work with some of the best dentists in the world, we suffer with tooth prep and tooth impression. Why? Because it's difficult. It's very challenging. It doesn't matter how good you are. You can be a top dentist. You will have, in the analog world, you will have a lot of stress to make perfect preps and to make perfect impressions. And once in a while, every other day, you're going to have to call back in patients. You're going to have to retouch, or your technician will have to do magic trying to guess, or cheating the model, or overcoming limitations to develop restoration. So I loved when you said, if you use digital, thinking like analog, you're missing the point. You're not taking full advantage. So when you have a digital tool, you need to understand that the digital tool allows you to reinvent yourself, to do things in a different way. So when you do multiple teeth, we know the challenge in impressions is exactly what you said. You have 12 teeth, you know, and the silicone impression is one shot. It's one shot. And then when you put the cords, you need to control everything, and you need to place everything, and then you need to remove everything, and then you need to control the bleeding on everything, and the tissue is moving. So when you think about digital, I love the way you explained that if you have with iTero the possibility, instead of having to use a scanner with the analog philosophy of having to go for everything, but instead of that, using a scanner that you go step by step like this, and you don't have to go crazy and say, I need to be perfect at everything, but you go one by one. I think I just learned an amazing lesson here today that it was worth the conversation. I really love that. So again, trying to organize the thoughts here. I could, the same way we organize the scanning difficulties in 5 levels, we can try to organize the scanning moments as well. When you buy a scanner, you should judge by moments as well. Because nowadays, the scanner is much more than just scanning preps, right? It's just much more than scanning preps. So you have the scanner for the digital workflow, you have the scanner for the implant workflow, you have the scanner for the restorative workflow, for the orthodontic workflow. These are treatment workflows, but you also have the scanner. You have the scanner before that, right? You have the scanner as your best ally for first appointment documentation,
exactly,
for team communication, for patient motivation, and one of the most beautiful things for me, for diagnostics, right? The scanner will become your #1 partner on improving documentation, diagnostics, and communication. So how do you use iTero? In which moments you use iTero? And how iTero changed the way you do dentistry, not only on the restorative workflow, but how iTero changed the way, the journey of the patient in your office?
Completely, but I have to be honest, it changed since we are using 5D. We got one of the first 5D scanners already in November last year, and since I have 5D,
so explain a little bit to us.
Just exactly. 5D, yeah, the 5D is the possibility to scan a patient and detect caries. So you see lesions, you see caries in a very early stage. So this is really brilliant. And to be honest, we have very many patients a day, and we didn't scan everybody which came to our office. But now, since we have the option, even with the caries diagnosis, we changed it completely. We're scanning many patients, not everybody, but most of them. When they come to our office, we talk to them. We can show them on the scanner their problems. We can show them on the scanner caries. So, and if somebody sees the caries on the scanner, he believes us, because seeing is believing. We can tell them everybody. And I think every dentist knows when you tell the patient, oh, I see there's some caries in between your teeth, the patient answers always the same. Yeah, but I don't have pain. Why do you want to treat me? I don't have pain. So, and now you have a tool to talk to the patient, to show the patient its problem, and they all understand that there is something wrong. So then if you say we need a treatment, they believe you. They know that it's necessary to do a treatment. And afterwards, now we have the first cases which are coming back. We may now a review. When there are cases, we just have to monitor. You find so much caries which you just have to monitor. So we look at it. Patients comes back, perhaps half a year or a year later. We go again to the scanner. We're doing the scan, and my team is able to do the scans in between 3 minutes. So I'm not in the room. I just go back to the room. Everything is prepared. Yeah, everything's prepared. Yeah. And I'm just talking to the patient.
Hygiene session, right?
Yeah.
Every hygiene session.
Exactly. So in the first step, we look at, has something changed in the size of the caries? In the second step, we make something like a time-lapse function. That means we have an overlapping of the two scans from the last time and the new one. And the scanner shows us the changes. So we can monitor the patient much better, and we explain the patient, oh, you're a bruxer, or there's something you lost, or there's a movement inside your teeth, and we can show it to the patient, and the patient really understands the problems much better than he did ever before when I showed him some model in my hands and showed, look at this is now something else. So this is the main thing, what has changed in my office. We use the scanner as a communication tool, and this is brilliant.
Yeah. So just for people to understand, the ones that don't know exactly, the new version of iTero is called iTero 5D. 5D, correct me if I'm wrong, as the 3D, of course, from the STL. The fourth dimension comes from the color, and now the fifth dimension is seeing inside the tooth, right? So the 5D is because now iTero brings infrared technology in the same wand, in the same tip. And as you scan, it gives you an amazing image inside the tooth through the infrared, creating a black and white image of the internal surface of the teeth, right?
And what is important with the 5D, with a scan, when you scan the iTero, you have it just in one step. You don't have to do any extra scans because the wand is taking the near infrared pictures while you're scanning as you're used to. So you don't have to put on extra tips or whatever or do extra scans. It's just in one scan.
So that lens, the lens is 5D. The lens is giving you, that tip is giving you the 3D, the color, and the internal surface with the infrared. That's why they call it 5D. So I believe that, number one, I believe iTero is definitely, if we cannot say iTero is the best scanner for restorative, I think iTero is a great scanner for restorative, like others are also great. But I can maybe say, see if you agree with me, that iTero is the best scanner for first appointment diagnostics and treatment, and diagnostics and patient communication. Do you agree with that?
I agree. I absolutely agree. There are many tools at the other scanners, and I know there are tools now coming to the market, that we already saw, and the others are not sleeping. So the big ones, the big companies, all work on this. They all remark that they cannot sell a scanner just for scanning, especially not for the price they want to have. So they have to add some features. And now you, as a dentist, have to decide, do I just want to use it as an impression machine, or do I want to do more with it, like a communication tool and things like this?
Motivation, case acceptance.
Exactly. And this is something which all the others even know now, and they try to work on it. So other scanners even have something like an outcome simulation or something like comparison of scans. So they all work on it. Because they know it's necessary for the market now. But with iTero, it's so simple. You just push the button, and if you're in your daily business, I don't have time to make big software things and do comparisons and download it and upload files and whatever. I just have to have it quick and nice and simple. Press the button and talk to the patient. And this makes iTero really perfect. It's easy to use so that you use it so often.
So let's organize the thoughts here for everybody to follow us here. We need to analyze the scanners for the specific, I say, treatment workflows. I call it treatment workflows, meaning the scanner workflow for orthodontics and aligners, the scanner workflow for restorative, the scanner workflow for implants, let's say the three main ones, right? This is clinical performance with the scanner, and each scanner is a little bit better here and there, but they're all doing great job there, and iTero is definitely among the top ones there. Now, let's bring the scanner to the beginning. So it's a first appointment, documentation, diagnostics, and patient motivation, education, case acceptance. So on this initial moment, as you said, to get your return on investment, you need to use the scanner at its full power. You cannot buy a scanner as an impression machine, as you said. I love that term as well. If you buy a scanner to be just an impression machine, you're underestimating the power of that machine, right? Of this technology. So when you bring the scanner to the beginning of the process for communication diagnostics and education and treatment planning, team communication as well. We already mentioned on the iTero the new NIRI technology that I think it's amazing that comes inside. Other features that I think are mainly 3 other features that I wanted you to comment, and how do you use them with your experience, right? The outcome simulator, the progress assessment, and time lapse. I think these are 3 amazing features. First, outcome simulator. I believe, being able to scan your patient on the first appointment that never thought about doing orthodontics, and then the scanner, through artificial intelligence, without you doing nothing, in 60 seconds, generates an ortho simulation before and after. How do you like this feature? How do you use this feature? And how this helps you to link better the restorative and orthodontic world?
So first of all, aligner therapy is something what everybody should think about and even do it. You don't have to do it your own. Perhaps you have somebody who does this better because you're not sure how it works. It's something like an orthodontic treatment, but every time you do a restoration, you do a restoration, you have to think about it. And if you analyze a patient, you have to think about first if it's not better to move the teeth in the right direction before you drill something off and make something like a veneering or whatever. What doesn't have to be necessary. We have a time of now. We just don't want to prep very much. We just want to help the patient with micro-invasive therapy. So everybody who is doing work on patients has to think about aligner therapy. This is the first most important thing. The second thing is the outcome simulator is such a great tool. And we have an office which is now over 40 years old, many patients which are from my father, and but they always ask us, for example, things like, can we have the teeth a little bit brighter? And my team is now educated. They say, we can have it brighter, but we can even straighten your teeth first. So, and then we make a scan and we show it to them, and then we use outcome simulation. And outcome simulation is impressive because, again, patients see with their eyes what they get, and again, what you see is what you get, and if you see what you get, you're much more convinced. And I can really say, when we talk about this therapy, about straightening teeth, I explain how that could work, and then the patients always ask, but how much is that, doctor? And I try, first of all, not to speak about the money. I want to give them a vision of what they could look like. But at the end, you have to answer this question with some certain times. And this is something where outcome simulation helps you, because when the patient comes to you, many of them know that aligner therapy is possible, and they Googled and read, it's about 3, 5, 6, 7, whatever, thousand euros. And then you tell them it's about something like this. And then the patient says, oh, no, I thought it's about $100, so I cannot do this. But most of them say, I knew about this. It's much money, but I want to have this. And then I use outcome simulation, because when they even see later, this is the smile. I always laughed like this because this incisor was not nice, and I don't want to. if they see what they get, 70% at once say, doctor, let's do it. I want to have this. I want to have this like you showed me, and then we start treatment. So it's so convincing to the patients. And this is the reason why I love outcome simulation.
It's extremely powerful. The numbers of case acceptance here at the office when we started to use it, you don't even say nothing. Sometimes the outcome simulation comes before you even explain the possibility of orthodontics, and the patient is already pointing to the screen and say, what is that? You know, that's so cool. I like that. You know, I want to. Other one that I wanted you to comment is time-lapse. Probably the ones that I like the most, because I believe time-lapse will become routine for every modern dentist in the world, because we will be able, we will need to scan every single patient on every single hygiene session. And when we do that, time-lapse will be overlapping different moments of the history of the patient and giving you visually the information about what is going on. What do you think about time-lapse?
I think time-lapse is a really great tool, not just for to check if orthodontic treatments are stable, and you have so many options. You just have to think about how you can use this. For example, especially like a therapy with my hygienists. So you scan them every time. You can see the changing of the recessions. You can change of the gingival areas. I think we will have in the future even some AI inside, so that we will get some advices, so that we automatically we will see what is happening. So, but we have to collect some data now, which you can use in the future. Time-lapse is a great function. If you have a new restoration, you can check it if there are some balance, whatever, if the contact points are okay. Even if you do implant restorations, you can see if the implants, when we now know even implants are moving, implants are not that stable as we thought, you can check everything detailed. And even again, you can show it to the patient. And it's but not just talking to the patient, it's even something for me. And you even can do, what I even learned a few days ago, you can even check if a patient is coming to you with some pain, and you're scanning the gingival area at the apex, you even can see there is some changing. And then you know there is some swelling. So you don't see something on the x-ray, but you see it on your time-lapse function. So you know, okay, there is something wrong, even if I don't see something on the x-ray. So these are also great options. And as you said, we have to rethink dentistry. We're used to analog dentistry because we had nothing else. Same thing with the articulator. We've tried to rebuild articulators in a software. Why that? Articulator is just something from analog dentistry. What we needed because we had nothing else. You can forget it. We can do it individual movements now. So this is something what we all have to think about. And I think we both don't know what the future will bring. Perhaps you know more than me, but we have so many options. This will be great even in the future.
Yeah, you're totally right. You know, when we see doctors like you and the way we speak as well about this technology with so much excitement, is because we see the benefits. Is not for us, it's for the patient, you know. And we see that it's going to become mandatory. Patients will demand, you know, when patients understand that with technology you can follow up better the case, you can maintain better the case, you can forecast problems before the problem gets worse. Patients will say there's no doubt, you know, I'm not going to go to a dentist that doesn't have this technology or is not taking advantage of this technology for my own benefit. So that's what I usually tell people is you're going to have to embrace these things, and regardless if you like it or not, it's not for you, it's for the patient. They will demand a modern dentist. Modern people will demand modern dentists. So the last feature that I wanted you to comment is case assessment. And case assessment is related to Invisalign. And as I learned, Your clinic is an interdisciplinary clinic, is that correct? You do ortho, you do everything.
Yeah.
Your background is restorative of orthodontics.
A little bit of both, but just don't ask me to do any root canal treatment.
Fantastic. So, but yeah.
Yeah, I'm educated even in orthodontics. So we're treating I'm treating orthodontic patients since 20 years with braces and all these things. What we're doing.
So from the interdisciplinary perspective, I think the concept of case assessment will become mandatory as well. That means the philosophy of case acceptance that I think is great. It means that every procedure will be simulated in the 3D before you perform in the mouth. So that simulation will become your guide. And then technology will allow you what we say guided dentistry. We'll fabricate devices, aligners or stents, indexes, guides, whatever, for you to perform. And as soon as you're performing something in the mouth, technology will allow you to compare your performance with the initial simulation to allow you to fine-tune and compare and detect if the process is following the plan. So more specifically on orthodontics, the iTero allows you to compare the Cleantech evolution, right?
Yeah.
With your initial, actually the Cleantech evolution suggestion with the real evolution in the mouth. How that helps you to improve and become a more efficient orthodontist or deliver a more efficient orthodontic treatment.
This is extremely helpful because you learn so much with this tool. You learn what is possible, where did you do something wrong. So if you compare those those scans and the reality with the planned situation, you see, okay, best is always the second, the lateral incisors. You have to do something to fix them. Are they still on the road, or do you have to do something else? Or perhaps next time you change the attachment because you have to fix them more, or things like this. So this is a tool for us really to learn how something behaves in the mouth, what is possible, and where you did something where nature doesn't want you to do this.
Yes.
So this is so helpful to us.
Can you say that case assessment is almost like a biomechanic lesson?
Yeah,
so
it is.
Every case teaches you through case assessment, because we know that on the computer we can move whatever we want, but in the mouth, the reality, you need to teach the computer the reality in the mouth. And case assessment is like the computer teaching you the difference between what you thought was possible and what really is possible. And with that, you become a better orthodontist case by case.
It is. And at the end, we're again teaching the computer, because the computer knows if I'm planning things like this, the computer has to say, no, doctor, don't do this. It will not work. So at the end, we're getting better, and everybody of us will get better by a mistake I did.
Yeah, exactly. So we know that case assessment is probably the most powerful tool to feed a line to invest in artificial intelligence, and they are already doing that. And we know that year after year, by showing to the computer, this is my plan and this is the response in the mouth, and then case assessment comparing these two things, this will feed artificial intelligence to start making conclusions and helping us to make better decisions to our patients.
Yeah. It is, truly.
That's
Absolutely.
the future. There's no way back.
No. And it's not the future, it's the present. Yeah. Everybody's talking about in the future we will scan it. It's not the future. We're talking about the present. And everybody who is not changing now into the digital world, he will fall down at the end, because it's not something what some freaks are doing now. It's something what everybody should think about doing it.
It's what every patient wants. It's what every patient wants. And they are the main reasons why we are dentists, the patients. So I see many times dentists commenting about new ideas from their perspective. And what I usually tell them is like, try to think about the patient perspective a little bit, you know, and see what helps them. And I believe that all the technologies that we've been talking about are completely aligned with what modern consumers are looking for. So it's not only great for dentistry, but it's great for our business. And we know that great dentists, I usually say, technology will not transform a bad dentist into a good dentist, but technology will take a great dentist and make it even better. And we need to be able to embrace these technologies. We cannot fight against evolution. That's the reality.
Yeah. And at the end, somebody who is doing bad analog impressions, to be honest, will not do perfect digital ones at once. So,
but even the bad ones, I would say they will be less bad with technology.
I think so too, because when you see that big on a screen, what you did there, and you will really send this to a lab,
you cannot cheat. You cannot hide.
No, you cannot cheat. You cannot say, yeah, it looks in the mouth quite different and it was so difficult and all those things. So
digital gives no excuses.
Reality, this is what you did. This is your preparation, this is your retraction, and this is your scan at the end. And when you send this to the lab, you have really to be a good dentist to send something real good to your technician.
Now, to finish, Ingo, I just want you to finish with the final message, maybe an advice for clinicians that have an iTero already. How to take the most advantage of iTero. If you could summarize a suggestion for people that just bought it.
First of all, training. I have so many colleagues who were telling me at the beginning when I was showing them just to scan in 3 minutes, oh, this is not possible. We're needing 15 minutes for a scan and it is not getting better. It will get better. You have to train it and you will be able, and everybody of my colleagues was now able to do it in between 3 to 4 minutes. This is the first thing. Train it and use it. Don't put it away and say, oh, just it's not working, bring me my analog impression because I'm in a hurry. Take your time, train scanning, and the most important thing, care about retraction. Because you cannot cheat with a scanner. When there is a little bit of bleeding, you will see it on the scanner. When you have an analog impression, you can press something around and hope that nobody is seeing it. With an analog impression, you have to be really, really honest to yourself. So the second thing is care about your preparation and care about your retraction. This is something for restorative. But if you have an iTero, don't think it's an impression machine again. Use it for every patient. Think about a new strategy in your office. Think about a scanning every patient's strategy, because at the end it works quite fast. It's not something where you lose time, but you collect so much information for modern dentistry, for patients who will understand what you want to do with them, for patients who understand why you want to treat them, who see how the development goes on. So if you have an iTero, think about a new strategy in your office. Perhaps you say, no, that's not I don't want to do this, but everybody should think about, because it's so important for modern dentistry.
I usually say that to take the best advantage of digital, you will only take the best advantage of digital, clinical and financially, when it becomes a routine, when you don't even think.
Yeah.
You do for everybody, every appointment, every time. And you agree with that?
I totally agree. Yeah.
So we are completely aligned. I want to finish, Ingo, thanking you again for your time. I think this was an amazing discussion. The information we recorded, we played this live on social media. We have many people watching us. We're gonna make this video available for everybody that wants to watch afterwards. I think you know, people should definitely watch this and make notes, because with your experience, you were able to share very, very interesting tips. I hope that in the near future I can come visit your office, and also that you maybe could come to one of our DSD events and lecture for us,
I would love.
and do live patients with us in some of our live patient events. We really want to learn from your experience to take our iTero experience to the next level.
I would love to. So the picture just stopped, so I cannot hear you. Yeah, now you're back again. But if we meet us next time, you know, we still have open a tennis match.
Okay, so that's a deal. We will talk about scanners, we will play tennis, and we will have great beer.
Okay. Just tell me where I have to go.
That's a good tripod, huh? This is a good combination. Ingo, thank you so much. This was amazing. Thanks for your time. We stay in touch. I hope everybody enjoyed, and we see everybody, our online community, with our next coffee break with Coachman. See you guys. Bye-bye.
Bye.